Hello and welcome. Today, we're diving deep into a lesser-known but fascinating condition affecting the kidneys: Page kidney. This condition, named after Dr. Irvine Page, is a unique cause of secondary hypertension, meaning high blood pressure caused by an underlying medical issue. Join us as we explore what Page kidney is, what causes it, how it affects the body, and what can be done about it. So, what exactly causes Page kidney? The root of the problem lies in external compression of the kidney. Most often, this compression is due to a subcapsular hematoma, which is a collection of blood beneath the kidney's outer capsule. This hematoma typically results from blunt trauma to the flank area, such as a car accident, a fall, or even sports injuries. Less frequently, Page kidney can be caused by other compressive lesions like urinomas, a collection of urine outside the urinary tract, abscesses, or even tumors surrounding the kidney. Now let's understand the pathophysiology behind Page kidney. The compression of the kidney parenchyma by the subcapsular collection leads to renal ischemia, a reduction in blood flow to the kidney tissue. This ischemia triggers the renin-angiotensin-aldosterone system, or RACE, a hormonal system that regulates blood pressure and fluid balance. The kidney, sensing reduced blood flow, releases renin. Renin initiates a cascade of events leading to the production of angiotensin II. Angiotensin II is a potent vasoconstrictor, meaning it narrows blood vessels, increasing blood pressure. It also stimulates the release of aldosterone, which causes the kidneys to retain sodium and water, further increasing blood volume and pressure. This sustained activation of the RAS due to chronic renal compression is the primary mechanism behind the hypertension seen in Page kidney. Due to the relative rarity of Page kidney, precise epidemiological data is limited. It is most frequently seen in individuals who have experienced recent blunt abdominal trauma. Therefore, those who participate in contact sports, work in high-risk environments prone to trauma, or have underlying bleeding disorders might be at a slightly increased risk. It's important to remember that Page kidney is an uncommon cause of hypertension, even in these populations. The signs and symptoms of Page kidney can vary, but the most prominent feature is, of course, hypertension, often severe and resistant to standard blood pressure medications. Patients may also experience flank pain or tenderness, especially on the side of the affected kidney. Depending on the cause of the compression, there might be visible signs of trauma, such as bruising or swelling. In some cases, especially with chronic compression, patients may have vague, nonspecific symptoms like fatigue, headache, or visual disturbances associated with uncontrolled high blood pressure. Diagnosing Page kidney typically involves a combination of clinical suspicion, based on the patient's history of trauma and the presence of hypertension, and imaging studies. A CT scan of the abdomen and pelvis is the most common and effective diagnostic tool. It allows visualization of the kidney, any subcapsular collections, and other potential causes of compression. Ultrasound can also be used, especially in settings where CT scanning is not readily available or contraindicated. Renal arteriography, a more invasive test that involves injecting contrast dye into the renal arteries, can be helpful in confirming renal ischemia. Finally, measuring renin levels in the blood can support the diagnosis by demonstrating increased activity of the renin-angiotensin-aldosterone system. Page kidney isn't usually categorized into specific types, but rather it's described based on the underlying cause of the compression. We can differentiate between traumatic causes like subcapsular hematoma and non-traumatic causes like urinomas or tumors. The chronicity of the compression can also be considered, with acute Page kidney developing rapidly after an injury and chronic Page kidney developing gradually over time. The treatment for Page kidney focuses on relieving the external compression and restoring normal blood flow to the kidney. The primary treatment modality is surgical intervention. This typically involves draining any subcapsular collections, such as hematomas or urinomas. If the compression is due to a tumor, surgical removal of the tumor is necessary. In some cases, minimally invasive techniques, such as percutaneous drainage, can be used. In addition to addressing the underlying cause, medical management of hypertension with antihypertensive medications is often necessary until the compression is relieved. However, it's important to remember that these medications are typically less effective until the underlying cause is addressed. Preventing Page kidney primarily involves preventing the traumatic injuries that often lead to it. This includes wearing seatbelts in vehicles, taking precautions to avoid falls, and using appropriate protective during sports and other activities. For individuals with bleeding disorders, careful management of their condition can help reduce the risk of developing subcapsular hematomas, even with minor trauma. The prognosis for Page kidney is generally good, especially when diagnosed and treated promptly. Once the external compression is relieved, blood pressure typically returns to normal or is much more easily controlled with medication. Delayed diagnosis and treatment can lead to chronic kidney damage and persistent hypertension. Recent research is focusing on refining minimally invasive techniques for drainage of subcapsular collections, potentially reducing the need for open surgery and improving recovery times. Additionally, ongoing research explores the role of specific antihypertensive medications in managing the hypertension associated with Page kidney while awaiting definitive treatment. Thank you for joining us on this exploration of Page kidney. We hope this information was helpful.